Of England shows if you have a healthy mouth, you are less likely to develop dementia later in life. That's because the bacteria on your gums can make it all the way up to your brain, causing inflammation and potentially brain damage. Dr. Scott Harris of Harris Dental is here to talk about this study, and it's interesting to be able to link the two together. Will you go into more detail with us?
It is. So the study that they did, basically they looked at the tissue of somebody with dementia versus somebody without dementia. And what they found were higher levels of bacteria in the brain tissue that is a bacteria that's typically associated with gum disease and originates in the mouth.
Interesting. Okay. And I'm assuming when they do this study here, they're looking at more or less our senior citizens. I know from my own experience with my dad, he really didn't take care of his teeth because it wasn't as, I guess, publicized, highly publicized as it is now.
That's correct. Another study basically showed that when they looked at around 5,000 elderly people, what they saw was about the people that brush their teeth less than once a day versus those who brush their teeth 3 times a day, as recommended by the American Dental Association. They saw that those people were 65% more likely to develop dementia later on, or at least have increased symptoms or signs of dementia later on.
Wow. Okay, I didn't realize it was 3 times a day. I thought it was 2, but wow, that's incredible. So, you know, for some of the senior citizens that are out there that may have not been taking care of their mouth, are there things that they can do right now to help reduce the chance of getting dementia?
Absolutely. The biggest thing that people can do is to get things clean. Home care, regular home care, consistent home care is going to be a big thing, as well as senior hygienists regularly. People don't realize that the bacteria that is in the gum tissue can get into the bloodstream, and it can cause a number of different effects throughout the body. This bacteria in the study in particular is called P. gingivalis, and it has actually been linked to rheumatoid arthritis, cardiovascular disease, diabetes, and now, of course, they're looking at dementia as well.
So this bacteria, how quickly does it develop? And I mean, again, is this something that develops overnight? I mean, it's kind of scary to look at this.
Yeah, so everybody has this bacteria, or most people have this bacteria in their mouth. When it becomes a problem is when this bacteria is seen in higher numbers. So when it builds up underneath the gum tissue, that's when it really becomes a problem. So that's where it becomes important to keep everything as clean as possible. And part of that, again, is home care and seeing your hygienist regularly.
Yeah, at least once every 6 months still. Is that still the same? Is that...
Yeah, well, everybody's different. Everybody's different. And some people do have higher numbers of this particular bacteria in their mouth. These people are going to be a little bit more prone to developing gum disease, and therefore it's a little bit more important that we see them more regularly than somebody that doesn't have the high numbers of these bacteria.
Yeah, so certainly ask your dentist. Scott Harris, thank you very much.